to join. Mhm. हाय हाय डॉक्टर आशीष आपकी आवाज कम आ रही है। हाँ, आई थिंक अब आ जाएगी। हाँ, आ रही बट इट्स वेरी लो, लाइक लेस।
अभी आ रही है?
हाँ, आ रही है बट कैन इट बी लाउडर इफ पॉसिबल? नहीं है तो इट्स फाइन।
अब ठीक है? कोई चेंज?
थोड़ा सा चेंज हुआ
I'll
है
try to
पार्शली बट
I'll try
चल
to
जाएगा।
I'll try to speak loud.
हाँ,
That's all right.
प्रोबेबली।
Yeah. So tell me,
हाँ,
how's everything morning?
गुड मॉर्निंग। हाँ, सब सही है, बढ़िया। एंड द वीडियो डिड वेल
Okay, yeah.
और
I
there
saw.
were so many comments and questions and likes, so it felt nice. Thank you for that amazing podcast.
Yeah, thank you. And it was needed. I mean, I even I could see lots of people they were commenting on Insta, and I got few DMs as well about
Okay, nice.
still people have like small doubts. You cannot cover everything in just one video.
Right,
Right.
right. The
Especially like
DMs, where did you get the most DMs? Like on emails or on Instagram?
mostly on Instagrams. Mostly on Instagram. Some were on
Okay,
one or two on YouTube channel itself. I mean, so yeah.
okay. मुझे भी mostly comments ही आया YouTube पे, and then there were some emails and some people who wanted to directly get in touch with you, get mentored by you.
Yeah, yeah.
So उनके भी आए.
Okay.
And Instagram DMs were, for me, Instagram
Less.
DMs were less.
Nice.
uh,
Okay.
so
So
let's
let's
start.
yeah.
हाँ, बताओ
Uh,
आज का. So I'll introduce, probably it's easier.
mhm.
So the
Yep.
topic is UAE for me or not? Because a
Yes.
lot of questions were around this. Some
Mhm.
pediatrics guy messaged and asked if it is good for pediatrics, and then someone who has actually done DM or MCH, they also asked, is it better now or should we go to US first and then come, and what fields? So let's just discuss it in a little detail. Is UAE for me or not?
Yeah. Yeah. Yes.
बढ़िया.
So I would say like to start with let's make three categories. Like one is those who want to come to UAE right after their med school, right after MBBS or BDS.
Right.
Then those who want to come after their MD or MS or DNB. And the third
ठीक
is
है.
like super specialist, those who want to come after their DM or MCH, right? So those
ठीक है.
there are if you go to the DHA website, there is a nice PDF. There is a nice whole detail. They have kept it over there, right? After like so they have classified into three tiers, right? Tier one, tier two, and tier three. So
Okay.
tier one is like as we spoke already in the podcast about first world countries like US, UK, Australia, Canada. So there are two things. Like one is your main specialization, and the second is your sub specialization, right? So
Okay.
sub specialization is the one you want to like you want like I want to work here as an endocrinologist. I want to work here as a nephrologist. So that becomes your sub specialization thing, right? And then there is a like like main specialization, I should say, is like either your MBBS, either your medicine, either your surgery or something like that. So
हम्म.
they all have tiers. Like आपने main specialization tier one से किया या tier two से किया या tier three से किया, सब specialization आपने किस tier में किया, right? So
Okay.
let's just talk about our country कि यहाँ से करने के बाद आपका what's the scene, right? So I've made a nice I did a small study on that. So if you talk about tier two, your main specialization from India, right? Like suppose you are
हम्म.
just an MD or MS candidate, so you need to have, first of all, you'll get a specialist license, right? You'll not get a consultant license. Okay. To
Acha.
start with, I'm saying, right? So for that, you need to have at least 2 years of experience after you get graduated. Right? After you finish MD or
Okay.
MS, you need to have a 2 years of experience before moving in here. They'll not give you a license.
So MD or M, even after MD or MS, you need 2 more years.
Yeah, you need to have
Okay.
experience. Yeah.
Okay.
and
So
then
in all
and then
5 years after MBBS.
Yeah,
Right.
exactly. Yeah, and then they have, like, if you are local, if you are not local, and all those things. That's all there in their document, right? So and then after that, you can apply for a specialist license here. Once you are a specialist here, then you can get the work experience and anything. Then you can become senior specialist. There are some hospitals, there are some places, they they have certain posts called as senior specialist. That's it. That's all you can do after MD or MS. You cannot become a consultant. If you are a tier
Okay.
2,
So consultant is above a specialist.
above a specialist, definitely.
Okay.
Yeah.
Okay. Got it.
Now, yeah, that's just for the postgraduates. That's just for MD, MS, or DNBs, right? Now comes, like, if you have a DM or if you have an MCH qualification from India, which is tier 2. So even before moving to UAE, you need to have again 2 years of experience post finishing your DM or MCH. Most of the time, that's the requirement in, I should say, quite a nice setup, like big, like the hospital I am working in, like in public sectors, in semi-government, in big privates. I'm not talking about the clinics or small things. There can be
Right.
certain, like, there can be certain loopholes, like, let's not go into that. Let's just stick to the ideal, what is
The general part. Yes. Yes.
so once you are 2 years post your super specialization, then you can come here as a specialist. After that,
Okay.
you need 5 years of, like, total 5 years of experience. Like, suppose I got my MCH finished in 2021 January.
Hmm.
I
Hmm.
can go for a consultant license exam in after January 2026. Till that time, I
Okay.
have to work as a specialist. Yeah. Suppose some
Okay.
now someone asks me, okay, like, what should I do? I'll not move to UAE. I finished my MCH or DM in 20 or 21. Should I can I move directly as a consultant in UAE after 5 years? Like, I don't want to, so still you can give the licensing exam, but still they'll ask you for, if I'm right, it's 2 years of experience at least in UAE. Only then you'll be
A consultant.
consultant. Yeah. So they
Okay.
need a UAE experience. You cannot be directly, if
So
you
if
are a
you
tier
want to
two.
start in UAE, you will start as a specialist for sure. And after that, depending on your profile and the time you have spent working, it
Then you
can
can,
be a
yeah,
consultant.
consultant. Or
Hmm.
then
Okay.
either then the other option to get it done fast or something is, you get your med school done from our country, and then you can either move to US. I can see, like, there are few comments coming. People are asking about MCH.
Yeah, some
So
people asking
yeah.
exactly.
So what you can do is finish your. I would say, like, if someone asks me, like, doctor, now advise me the best possible way to come in with the best possible salary, with the best possible post. So I would rather suggest them, either start your med school or the whole career from either first world countries. Either, if you have already finished your MBBS or BDS, then go and get some clinical fellowships or some certifications, or your residency in either US, UK, Australia, Canada. Then you
Hmm.
can come here straight away. Like, suppose you got your medicine residency, your surgical residency program there. Then you can start working there as a registrar or a specialist or a consultant. Then you can straight away apply here for the post. You don't need exams. You don't need, maybe just a mere oral interview would be enough. You don't need any exam. I saw someone's query. So if you
Yes,
are
yes.
if
Sarthak
you are
Sharma asked
yeah,
if after USMLE steps DHA required or not. So if
yeah,
steps are cleared, then probably no
not
exam.
required. Yeah. If you are a GMC certified, if you are AMC certified, if you are MLE, if you are registered there, then it's not required. And then what I would say is, then if you are working there as a specialist or a consultant, depending upon your experience after finishing your degree over there, then you can get hired as, depending upon your experience or your post over there, either as a specialist or as a consultant. So becoming a consultant becomes a high probability if you have your residency done from there, or a clinical fellowships, or CCT match, CCT done, or GMC, worked as a registrar, all those things. Not just you finished everything from here, you just went for a 6 months fellowship or something, and then you'll be like, I want to, like, can I work here as a consultant straight away? No, it's not possible. You have to have
Okay.
your you have to have your residency, or you have to have your programs done from these countries, or
Nice. Got it.
else you get your experience there, and then you can go.
Or the life or the opportunity becomes easier once you have higher degrees like MD, DM, or it's
Definitely.
better to go after MBBS.
So it depends. Like, suppose it depends what one is expecting from UAE, right? Like,
Okay.
you just want to work like a office job. You come, you go, and that's it. So it doesn't matter. You can come after any like med school, or you can come after PG. You can come after D. But
Right.
let's talk about what everyone expects. Like, you want everything out of whatever is available, right? You want the best. So I think I would rather suggest to have DM or MCH. That increases your chances of because even if in India, even if you see names, even you see yourself, like suppose we get any problem, we would love to go to a specialist rather going for a surgery, right? Now these days it's all about having a minimal invasive surgeon for your lab surgeries. You want like bariatric surgeries. No one, I mean, people usually avoid going to a general surgeon or a medicine. You want to go to an endocrinologist, you want to go to a nephrologist, right? So even like here, if you want to, if you want to have your more chances of getting hired, you want to see more job opportunities, I think it's better to have a super specialization done.
Okay.
And then also it increases the chances of, once you get a proper work experience after 5 years, you can give the consultant licensing exam, and then you can work as a consultant
Okay. So it's better to spend some time here.
here, or US, UK.
Or US UK of course.
Yeah.
पर US UK से दुबई आना चाहते हैं लोग, like it's already
Yeah,
मतलब ये
that's
I know
so.
कि when I was in Germany, so my consultant used to go sometimes to operate in Dubai,
Yeah.
but that's not a very common thing to do.
So there are two types of doctors from these countries who have their career in UAEs. One is a part
Hmm.
time. One is a part time. You fly for a week here. You consult. You operate. You follow, and you go. You get money. You
Right.
go. The second is you just shift. So
Hmm.
considering like UK, lots of things right now. NHS is not really in great shape. Then the weather conditions in UK, it's very harsh. Like, I mean, it's too
Right.
cold sometimes. It's raining all the time. Because I have colleagues, I have consultants. Sometimes when you speak to them, they're like, when they leave for work, it's like dark. They work. When they leave back from the hospital going home,
Hmm.
they don't get to see sun, right? In UAE, I agree. Most of the months are hot and humid, but you get to see sun. You have pleasant weather as well. Sometimes, occasionally, it rains as well, right? So for them, weather condition is better here, and definitely like a tax-free salary, which is I think in UK, US, Australia, India, everywhere, like what doctors are earning, it definitely goes to the highest possible salary slab, right? So
Right.
income tax slab. So 30 to 40 to 50% income tax is the thing you have to pay, right? So the first
Hmm.
reason why they move here is the tax-free income, is the weather conditions are amazing, and it's safe. Safety and better quality of life is, I think, for everyone. Yeah.
Somebody has asked Mr. Bharat Narayan, how about
Mhm.
Australia? Actually, we are more discussing the opportunities in UAE and Dubai, so can't really say about
No,
it.
so
But we,
I can answer.
do
I
you
can
know?
answer just in a short. I can answer just in a
Right, that
short.
would be
So
great. That would be great.
is he asking? Is he comparing? Should I move to UAE or Australia, or is he asking
Oh,
how is Australia? Like, I want to get it clarified. So I would answer
okay,
both the possibilities, right? So if he's comparing Australia and UAE, definitely I would say Australia, right? Because
okay,
again, a few perks, like it's near to India again.
Hmm.
Then you have I would say better quality of life is in both the places. The only flaw is there you have to pay tax. Here it's tax free, but the quality of life over there, for the doctors, for the healthcare, for the salary you get, the amount you earn, I think it's more or less, maybe I would say 51-49 comparing Australia and UAE. So I would say if you are comparing on few aspects between Australia and UAE, better is Australia, because for to one more important reason is you go Australia, you work there. If you don't like, if you come back to UAE, you are a consultant, right? If you have your residency
Yeah.
program done there, if you have your fellowships
Hmm.
done, if you are certified AMC, then you can get hired as a consultant, right? The second thing is, if he's asking like, should I move to Australia? Then yeah, definitely is. It's better than UAE. Australia
And
and US and Australia and New Zealand, even Germany. You are already experienced with Germany, so I think it's they are to some extent better than UAE. If you leave apart the income tax, if you leave apart it's nearer to India, if you leave apart no language issues, if you leave apart yeah, some other
hmm.
issues.
But I think you cannot really leave them because these are important issues as well. For me, it was a big issue, the language, and also the
Yeah, yeah.
not so close proximity from India. Like to go home, I would need always 2 days extra leave because 7 to 8 hours if it is a direct flight from Germany, but usually it was a connecting flight because it was cheaper
Mm-hmm.
to Delhi and then an overnight journey to my hometown. And then when coming back again overnight journey, stay some time in Delhi, then take a flight. So it was almost a 20 hour or something
Oof.
journey
In that sense,
fastest.
in that sense, if you compare UAE, I mean India and UAE, they have, if I'm not wrong, maybe 100 flights per day connecting across
Exactly.
the
And not just
destinations.
from
At
Delhi,
least
it's
100.
from a lot
Yeah,
of
yeah, it's
cities.
from everywhere. It's from everywhere. You have from
Yes.
Hyderabad, you have from Bengaluru, Mumbai,
Hmm.
Delhi, Ahmedabad, all the major cities. They have direct flight to both the cities, Abu Dhabi and Dubai.
And as you said in the podcast, language is also not a big issue.
Not
A
really
lot
an
of
issue.
people speak English, and then you have a translator. So you don't have to learn actually to become a
Exactly.
doctor.
That's the major point. You know, lots of our patients are locals, Arabic, or even not locals. They are from other parts
Hmm.
of Middle East. You know, like maybe Lebanon, Jordan, Egypt.
Right.
So most of our nursing staff, even our other staff, you know, they are Arabic. So you go with them, you take rounds, so they can translate for you.
Hmm.
Rest all population here, they speak English well, or the younger generations of our patients, honestly, they speak English, even it be locals, even it be other parts of the world. So
Good.
and most of the
And
time I speak Hindi as well. So
so there is one comment. What is scope for branches like pathology? So
uh,
that reminds me, let's go back to our main topic
yeah.
of today's discussion. The
uh,
scope for different branches in UA. My direct question
mhm.
is there a shortage of doctors or paramedical staff in UAE? If yes or no, but are there some specific branches who
Mhm.
are more inviting for doctors?
Yeah. So I would answer like, as the number of people from world across, it's a huge influx from across the corners of the world, people coming to UAE. So it's growing fast, right? So
Hmm.
we see every now and then there is a new clinic getting set up. Some hospital, they are opening their new chain in a nearby cities, or a small hospital is getting converted now into a bigger hospital. You know,
Okay.
so definitely the demands are there. I would not say there is no demand, but there are certain specialties, or the fields which are in more demand. I would say I've done a few, since we decided to do this YouTube live session. I did some study. So as per the sequence, if you go, there are branches like cardiology, then you have pediatrics, radiologist, emergency medicine, and trauma is people say like it's, they have good traffic rules, they have good regulations, so they how
Yeah,
they trauma. But definitely there is a huge lot of trauma here, like
because
huge,
of the fast cars,
insane,
probably.
because of, yeah, because of the fast cars, because of the industrialization, because of the, you know, like high end machineries, all those things. We
Hmm.
get like in our unit we get trauma like really crazy. Yeah. So and definitely plastic surgery and dermatologist. If you speak about other like GPs, even if you want to move after straight away after MBBS, I would say the GPs are the one who are required everywhere almost. So
Yes.
someone wants to really move after their med school, so getting some experience, and then you can work as a GP, get some aesthetic GP, like get some training done with chemical peel and all those things, so you can work as an aesthetic GPS, though the salary would not be that great. But yeah, then if you want to move, if you have your near one dear one, suppose someone's spouse is already here and they are just med school grad, so they, if they
Hmm.
want to move, they can move as an aesthetic GP, right? Then comes psychiatrist and psychologist, as I already said in the podcast. Then you have
Yes.
OBGY specifically, who has worked with IVF, right? Those who have IVF
Oh,
experience, yeah, yeah. So,
okay.
that has more demand. Then comes everything like radiology, pathology,
No,
pediatrics,
the
even
ones you just mentioned are in high demand
in high demand.
so far. Okay.
Definitely, yeah. And then you
Okay.
have anesthesia as well. They are in good demand here. Yeah. And
And
then
radiology, dermatology, they are also in good demand.
good demand, yeah. Yeah,
Okay.
definitely. Then you talk about other super specialization like gastroenterology, you have nephrology,
So,
you have GI surgery, you have minimal invasive surgeons, you have
right.
bariatric surgeons. They are, because lots of here the obesity and the diabetes is really high among the local population. So you have
Okay.
bariatric surgeries, yeah, definitely. You have bariatric surgeries, minimal invasive surgeries.
Is
There,
is is obesity common there? Like,
definitely common. Here,
oh,
the type of cosmetic surgeries, the type of patients we get, the type of cosmetic surgery we have to do is most of the time after massive weight loss. It's like body contouring more than already a slim trim patient who is,
okay.
you know, it's most of the time they are like either already, I shouldn't say obese, still in the phase of reducing weight, or they are
Hmm.
sometimes, like most of the time they are like after massive weight reduction. So
Right.
that type of cosmetic patients are like in huge numbers here. So then definitely
Okay.
you get pediatric and minimal invasive. Then all anesthesia. If you talk about allied branches, pharmacist, physiotherapist, occupational therapist, hand therapist, nursing staff, they are in huge demand. They are definitely in huge demand, like physiotherapists for sure. So we can make a
Nice.
different podcast on their work experience, their qualifications, their expected salaries. What type of hospital setup or clinical setup they can work in. That's again a different big level of discussion.
For
But
the
here,
paramedical staff, you
yeah,
mean?
for paramedicals, for
Okay.
pharmacists, for
Yes,
nurses.
yes. That's actually also true for Germany. I wanted to talk about it as well, but
Mhm.
didn't find the time to read it up. But what I understand from my experience in Germany was that the nurses and physiotherapists are in huge demand. Psychologists, physiotherapists, nurses, and these emergency medical personnel. These are in great demand, like in lakhs, I must say. And even for them, the rules of language they have made it easier. For example, for the nursing profession, you don't have to give a very difficult exam, and the
So
hospital promotes it and pays for it and stuff like that. But yes, I will have to look into it to be able to speak something with authority. But yes, these are good. So I have made the list of what you said so far.
mhm.
If it's okay, I'll quickly recap.
Yes.
So we have the branches in demand are cardiology, pediatrics, dermatology, radiology, psychiatry, and
Psychology.
anesthesia, GI, nephrology. And for the surgical part, we have trauma surgery, plastic surgery, OBGY with
OBGY,
special focus on
IVF,
IVF,
IVF. Yeah.
then anesthesia, which is also kind of a procedure driven branch,
Yeah.
then GI surgery, bariatric surgery. And what I missed is general practitioner, which is always in all countries, including
Always
India,
in demand, right? Right
huge
from
demand.
yeah, right from because I mean, nobody stops once you finish your med school. It's most of the
Hmm.
people, they go for their
Specializations and super
specialization,
specializations,
or
right?
even if they are working as GP, they'll not work for long, like just for the preparation of it.
Ah,
So
but they are
that's
in
how
great
people go.
demand
Yeah. So
all over the world.
if somebody has already decided not to study further, If somebody have their spouses like really well to do, like doing with their careers, I think then
They should
GPR is
stick to it. Yes, yes.
and
So
the
we have a few
yeah.
comments from Jitendra Singh Pawar. Thank you, Jitendra ji. And then Dr. Pulag, if you do you remember Dr. Pulag? He was in Ames with us. He's a
Uh,
colleague.
oh yeah, 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 yeah. I remember.
So
Yeah, yeah.
he's asking what exam do we need to give post Indian PG to enter Dubai as a specialist. So that clearly
So
means Dr. Pulag missed out on our podcast.
yeah, yeah. So it's fine. I mean, Pulak, come on, you can call us directly, man.
But yes,
One thing I would say is so now there are four health organization here. I already spoke. DOH is Department of Health for Abu Dhabi. DHA is Dubai Health Authority for Dubai. Then you have
hmm,
MOHP, Ministry of Health of Prevention and something something, and then you have Sharjah Health University, right? So but the most important thing is just I would say if, like keep this in mind, all the students or doctors who are preparing to come to UAE, I would say just keep preparing yourself, keep your documents ready. Don't dig into really deep of which should I give DHA, should I give DH, because recently they have gave a news like we're gonna merge all these four and we're gonna make a unified single licensing system across the Emirates. So there might be few rule changes. Like I would say, I wouldn't say like considering the eligibility, considering your qualifications, considering your experience, exam pattern mostly gonna be the same. But when to apply, how to apply, which website it's gonna be, when will they'll be keeping the exams, will the fees gonna increase or not increase, all those things. Let's keep another session for that once they release any more
hmm,
news of that. But as of now, if you want to ask me, for Dubai it's DHA, they have their website. DHA, DUH, they have their website, and MOH, they have their website. You can go onto that, you
right.
can see what all experience is required, and you can create your account, and then you can see what all eligibility, what all certificates are required, and which post you can apply for. There is a in their website there is a portal called as Sheryan, Sheryan, Sheryan portal, where you can just create an account and you can enter like, okay, I finished my med school in 2010, I finished my grad in
Okay.
2013-14, I finished DM in 17-18, I worked here, I did my fellowship, this that, and you enter all the details, and then you just click, then a pop-up will come, okay, you are eligible to work here as a specialist, or you are not eligible, you need to have experience, you can work as consultant, whatever. So there you can check exactly like are you eligible, or if you are eligible, for what post you can apply for. So that's
Right.
called a Sherian portal, where you can check your eligibility. But that's gonna change in sooner time once they come up with some unified license.
Unified.
Hmm.
Right. Okay. And then are there any branches which are actually saturated? There is hardly any scope, or it's heavily competitive.
So I would say definitely there are branches like medicine, surgery. Surgery is still in somewhat demand, general surgery,
Okay.
and I think medicine, even plastic surgery, because most of lots of influx of plastic surgeons here in UAE, and I would say, I mean, I mean, if I would say, it's like to work in a bigger setup, to work in a bigger public hospitals, to work in a good, like big private
Hmm.
setups. Most of the branches, they are, how would I say, I mean, in some or the other way, it's in demand, right? It's not like it's completely saturated, right? But when it comes, it's like medicine, plastic surgery, general surgery to some extent. It's in saturation.
Okay.
Then you have it's difficult to say, honestly. I mean, it's really
Right.
difficult to say, because when we, there are few WhatsApp groups, there are few organizations here. I every now and then I keep on seeing randomly, okay, requirement of an endocrinologist, okay, requirement of a general medicine,
Okay.
requirement for, but to exactly see the number, like, okay, which is in shortage, which is in high demand. So the frequent advertise I see is the branches we already discussed, but once
Hmm.
in a while I keep on seeing other branches as well, right? Like medicine and
Got
also
it.
I would say like rather stressing upon, like whether my branch is in demand or is it like really saturated. If I'll ask you about India, like what's the present scene, which branches are like really in demand, so then you will be like, in Delhi most of the branches are is like overly saturated. If you go a tier
Hmm.
2 state, if you go to tier 3 state, so I think and then there is a doctor, I would not take the name. He contacted me on Instagram, and definitely I would say this point, please guys, don't change your field of interest depending upon, okay, is this branch saturated in India,
Oh,
is this
definitely.
branch saturated in
Hmm.
UAE. I mean, see, already
Hmm.
our field is so highly, I would say, stressed. If you take a branch right now, like, okay, so dermatology is like really high in demand, but I don't really like dermatology, but it's in demand, so I will take dermatology. So don't work or don't choose your specialty depending upon it's in demand right now. No, only
Right.
take the specialty which you like, you always wanted to do. And definitely you can think of something. Okay, so right now if you see like, okay, diabetes and obesity is, it's getting increase in the
Hmm.
community, right? I'm interested in medicine, so should I choose neurology or should I choose, then you can somewhat think about, but changing your branch completely from either surgery or radiology, because right now radiology is like in huge demand, I will never agree to it. Always choose the branch first which you like to work, which you already
Absolutely.
interested to do in. Then see like, okay, so right now UAE is saturated for that, but yeah, Australia is inviting me. If you really want to move abroad, then move to Australia, right?
Hmm.
Rather changing your,
Can
so
change
I even
countries, but don't
yeah.
change the branch. Right.
So always work,
Hmm.
like just don't, let's not talk about even medical field. Like you are interested in engineering, but your family
Hmm.
forced you to go into the med school, then you chose med school, now you're not happy. It shouldn't be like that, right? Should always
Right.
work which you are interested in, right? So I would say, so that doctor, I advised him, like, I mean, he was asking me about oncology, radiology. He was asking me about few. Then I told him, doctor, please don't change your field of interest. First, get the best possible place, best possible institution, best possible country, your specialization done. Then see which place. So you might not even move out of your place. You'll open your own hospital
Hmm.
or a clinic. That's it, finished. Why you are stressed about right now that I want to move to UAE, so which branch is in demand, I'll prepare for that, and I'll definitely never do that.
And इससे मुझे याद आया from the DMs, we can actually select. I have selected two candidates.
Mm-hmm.
जैसा हमने पॉडकास्ट में बोला था, we'll select two candidates and ask one of them, ask you to mentor one of them.
Yeah, yeah, definitely.
So I have been able to select two emails. So
Mm-hmm.
you can choose, and we'll give your contacts and personal details to
Mm-hmm.
them. So one of them is Dr. Zaki. She's a
Mm-hmm.
consultant pathologist in
Mm-hmm.
India, and she
Mm-hmm.
wants to move to UAE as a pathologist.
Okay.
And I chose her because it just seems like there is not much information available for pathology,
Mm-hmm. Mm-hmm.
unlike medicine, surgery, and
I
those
have
branches.
I
And
have
I
few
have a
colleagues
feeling
who
that
are. Mm-hmm.
she might really benefit from your advice. And then there is one more candidate,
Mm-hmm.
Dr. Gaurav. He did his pediatrics from AIMS Jodhpur,
Okay.
and then he's doing his neonatology DM.
Oh, he contacted me on Instagram. Yeah,
Oh,
but
he did. He already did. So he has your contact already,
yeah, yeah.
probably.
Not really contact. I think just Insta DMs. So
Hmm.
to
So
start with,
maybe if
I
if
would.
Dr. Zaki or Dr. Gaurav, anybody is watching live, please say hi or comment, and we would be inclined to declare right now.
Yeah, if honestly, I would love to first meet or talk both of them,
Hmm.
and if I find both are like equally competent or interested or enthusiastic to come, I won't mind mentoring both of them.
Oh
Yeah,
wow, इतना
yeah.
time
So,
मिलेगा आपको?
so, so that's what I'm saying. Like if they are like really excited, enthusiastic, they have
Hmm.
like finally decided that they want to move. I would love to help both of them. Let's see. Yeah, I won't
Great,
mind.
great. So that's also done. Now we have covered the saturation part. The
Someone was
mentorship
asking.
part.
I saw some message popped up about job satisfaction and all those things. Yeah, some.
Ah, that was retracted. I also saw that somebody
Yeah, some.
messaged and then retracted it.
How about job satisfaction and
Hmm.
one more thing I would like to say to the audience is, if you have texted like with the start of this live session, if we somehow missed your message, don't feel like we are,
Ah,
like we are just talking and thing. You can a request, you can put a message again, or you can later on
yes.
DM us. Definitely will solve your query. Yeah.
Perfect.
So now, if you ask me about job satisfaction, so let's see. First is a medical field, then second is a surgical field. In
Hmm.
medical field, because surgery, whenever we ask, we always ask about hands on, we always about ask about how many patients I'll get to operate, like all those things. So that depends upon which clinical setup you are working in, right? Suppose I being a urologist, okay, a sort of like a high end clinic gives me a job offer, so I will be the only one urologist there, right? Even if I'm specialist, even if I'm a
Okay.
consultant, irrespective of that, I will be the only one who will be operating there. So I will be doing it. So the last time in my podcast when I said, like, I'm not really privileged to do a rhinoplasty alone. Same that
Hmm.
means we have a team of like around 10 to 12 plastic surgeons in my department. If you are doing a free flap, if you are doing like, suppose we do a big tummy tuck or bilateral breast reduction or something, so it's always a team, right? I don't do it alone, or my consultant or my colleague, they don't do it alone. It's always a team. One side is doing some, one other side is I'm doing it. If you are doing a free flap, so someone is dissecting the vessel, someone is harvesting the flap, then micro
Right.
will decide, then someone is
For
keeping
all
the
surgical
operate.
branches, I think you work
Yeah,
best when you work in a
you
team.
work in a team. It's always best for the
Hmm.
patient. It's always you don't feel exhausted. Like
Yes, yes.
you do it like.
Absolutely.
If you talk about medicines, so definitely there is a job satisfaction. You do see patients, you do clinical work, you do like you do everywhere, right?
Hmm.
So if you talk about a small, let's talk about in just a two sense, in a sort of a high end clinical setup or a private unit or a hospital like I am working in, right? So the hospital I
Okay.
am working in right now, if you are a surgeon, you will not get to operate that much as you were operating in India. Like, so because we know, like in India, okay, you are today, you are on
Got
duty,
it.
you see emergencies, you will do 10 cases in a
Hmm.
list, you alone will be doing it. So suppose in my unit, when we have 6 or 7 cases in the unit, I get one theater, my colleague get one theater, he does two, three, I does two, three, and the list is finished. Right, that way, because we have a team. But
Hmm.
but if I talk about a small or a sort of a high end clinic, it's only you who will be doing it. So you will be doing everything, right? You will be seeing the patients, you
Okay.
will be operating, you will be following up. So it depends upon which area you're practicing in. It depends, like how satisfied you
Got
will
it.
be.
Hmm.
And also depends upon the job, like the perspective of your job satisfaction, like what exactly you're expecting from your job. You want a salary, that we discussed. You want a time to time working, that we discussed, that's there. Job satisfaction, I think what he meant by the thing we already discussed, right? Like the surgical and the non-surgical. I think pediatrics, OBGY, medicine, endo, all these medical branches, definitely you will get job satisfied. If you're working in a good big hospitals, you will get like tons of patients to see, rounds to take, and all those things, some procedures to do. If you're in a
Right.
surgical setup, then it depends. Yeah.
ठीक है. Got it. And then one thing I also wanted to ask you mentioned in the beginning about the time it takes to be a consultant.
Hmm.
So, does the salary of a consultant become much higher after as compared to a specialist? Because
Definitely.
it's somehow
Definitely.
in my mind it feels like the goal should be to become a consultant. The way you said it.
Definitely
So,
you will.
is a specialist getting enough, or he has to strive to be a consultant?
So it depends upon, like, suppose I stay single here, so whatever I'm earning, for me it's so far working out. Suppose I have a family, wife, two, three children,
Hmm.
and I'm the only breadwinner of the family. So it won't be like, it won't be like really a tough job, but it will be like sort of a decent, okay, we are doing, like good. That's it. But if
Okay.
you're a consultant, you get like at least 30 to 40% increment in your salary comparing
Oh,
to a
that's great. That's great.
that's there.
40% increment.
Yeah,
Nice.
in your salary.
Okay.
I just saw one pop-up message of someone asking about MD salary range about MD practitioners, depending
Ah,
on the
that we have
branch.
made a reel.
Yeah. So depending on the branch, so I would clarify
Huh.
this. Salary doesn't change really depending on the branch, unless
Hmm.
it's like, suppose someone from an aesthetic surgical clinic is giving me a job, right? So they need a plastic surgeon, they need a dermatologist. The clinic itself is operating only on such specific sort of patients, and they really want me, they really want a plastic surgeon to work, they are like in dire need. So in that sense it might change, I mean, with few thousand dirhams it might change. But if you'll ask me, it's a post salary, not the branch salary. So if you are a specialist,
Got
you will
it.
get in that range. If you are a consultant, you will get it in that range. For bigger hospitals, for private hospitals, for semi-government hospitals, in these setups. If it's in a clinic, it depends. Like suppose I own a clinic, and I have a really good dermatology friend, and he or she wants to join me in my clinic. I would give him more, right? Something like that. So in a clinic,
Hmm.
sort of scenario changes, but not to a great
More or
extent.
less, it remains the same
Yeah,
across specialities and across
exactly,
places.
exactly, exactly.
Right. And what about one more question? What
Mhm.
about the exam itself? Do you know something? Can you tell some tips and tricks on how to prepare for MCQs? Or this
Yeah.
was
So
again very frequently asked.
yeah. UAE exams are good in a sense. They'll ask you the questions related to your specialty that we discussed
Hmm.
in our podcast. If you are a
Right.
pediatrician, they will be asking you only pediatrics question, some anatomy, some general medicine, some pharma questions. They will be there definitely related to your specialty. But pediatrics
Hmm.
exam, they won't be asking you, like lap appendicectomy. Lap appendix, or ortho
Got it.
questions and all those
That's
things.
that's great actually. That's
Yeah.
great.
So
उससे बहुत
so
headache बच जाता है.
बहुत so
Ah.
there will be specialty specific questions. Their
Hmm.
questions is mostly MLE based. It's like a long clinical scenario of 4 or 5
Okay.
lines. Then there will be five options. Some questions they will have none of the above. Some questions they will have the one single best answer. Some questions might have two or three answers that you have to decide and choose. Right.
Okay.
One good thing again is there is no negative marking in the questions. You lose, you lose. There is no negative marking as
Nice.
of now. I'm not sure of if they change now. And
Uh,
yeah, so we discussed this thing already in the podcast, that they don't give you passing percentage or failing percentage. They'll just give you, you cleared the exam or you failed the exam.
hmm.
So the good thing is, I think just stick to your. If someone is preparing for their UAE exams, I would advise them to stick basic clinical scenarios. Read on like clinical conditions, what you see in emergency, depending on your branch, what you see in emergencies, what you see in theaters if you're a surgeon, all those things. Don't jump into like value based questions and all those things.
Right.
Most of my questions out of 120, I would say, they were if I would say like nearly 100, they were like all clinical scenarios
Okay.
of 5 to 6 line.
So,
And
are there any books or something to
there are
specifically prepare
there are
for
yeah,
such?
there
Okay.
are few book online materials. There are I would love to have something of my own. I'm Me and Naman, for the audience, we are planning to have something of our own, considering the book
Yes.
if you want, considering the licensing help if you want, considering the data flow and processing if you want. We'll come up with
Hmm.
that soon. We are still figuring it out how we're gonna work it. So I would say
That would be great,
there are
actually.
different,
Yes.
yeah,
Yes.
there are different book materials. You can see it on Amazon. You can contact your colleagues, you can contact me, which books to read. But I would say mostly the questions are MLE based, mostly the questions are clinical scenario based. You get 3 hours of exam time, which is not at all enough.
Hmm.
Even
Acha,
for
it's
pediatrics,
less. Okay.
yeah, it's not enough. I think
Oh.
I already disclosed this in podcast that
Ah.
I cleared my exam in second attempt. In the first
Ah.
attempt, it was like I couldn't reach the complete paper. I think 17 or 18 questions I couldn't reach at the end. So
Wow.
it's a big time crunch. You have to read it fast. mostly big questions,
Hmm.
clinical based questions, and it's stick to basic clinical scenarios. Whichever topic you're
Hmm.
guiding, make your thorough with their clinical presentations. I think that's the
Perfect. So I'll quickly summarize what you just said. So it is majority of the questions are clinical scenarios,
Mhm.
and you have to read about them. You have to work well and be thorough with your own subject, which is also the good part that you are not asked about other subjects like pharma and biochem. And yes, and you have to be fast because the time itself is a little less. And don't get disheartened if you don't clear it in the first attempt, because there are many examples who have done it in second or third attempt. And that also you said there are three attempts maximum that are allowed, right?
Yes, yes. You can give three
Hmm.
attempts. Once you create your data flow, once you create your account, you get three attempts to clear.
Hmm.
And once you
And
clear,
another thing that you said, I like to repeat that we wanted to look for agencies and books and materials, and really it is difficult to find trustworthy
yes,
agencies.
yes,
So we are trying to figure it out how we can actually simplify the process and make you all able to do it yourself or with a little help. And we are figuring
the,
that out, and we'll be out with the plan soon.
the most important
So
is
as of
trust.
now,
You
we
know,
can hardly recommend any agency because
mm, mm.
then it becomes our responsibility as well.
Yes, yes. And the most important thing is trust. The one
Mm,
question everyone asks about agencies is definitely there is a word trustworthy. All the
right.
questions since 2 years I am here, almost now third year started, is everyone asks trustworthy agency, trustworthy. So if it becomes my liability or responsibility if I am giving you someone's name or number, and then you, I wouldn't say get cheated if you will not meet your expectations, then
Exactly.
bad on my part that I recommended the name. So I think
Right.
let's give us some time. Maybe hardly
Hmm.
a month or something. We'll come up with a definitely good solution for
Perfect. That would be great, actually.
that. Yeah. I
Nice.
just saw one message by Dr. Adhikari. I think he questioned something we missed, and he just put a message again. Doctor Sir, Doctor, please answer.
Oh, okay.
Yes.
Let me check. Yes, by Subendu Adhikari. What is the
Yes.
stable job scope after 6 years? DNB CTVS from India. I will be completing
Mm-hmm.
my residency of 6 years this June.
Mm-hmm. Okay.
Okay.
I would say CTVS is in decent demand. I would not say like really in high demand, or it's not at all in demand. CTVS, considering thoracic trauma, considering like lots of chest injuries and malignancy conditions, definitely CTVS is there. You look about one hospital called as Cleveland Clinic Abu Dhabi, CCAD. There they have a good cardiology, cardiothoracic team. Maybe you can find someone of your known working there or something first. Second thing is you need to have certain experience after you finish your DNB cardiology 1 or 2 years. So finish
Okay.
your residency nicely. Best of luck for your exams, and
Hmm.
join somewhere over there. Start working, and then start preparing simultaneously for DHA or DOH wherever you want to join, because you still need 1 year. After 1 year, things might change. Licensing systems might change. So work as you're working right now, and definitely you can contact us on DMs once you are ready to move here. Then we'll let you know. I'll let you know definitely which are the hospitals you can seek for.
Perfect. That's actually a great answer, and all the best, Dr. Adhikari. Uh,
For
so
your
I think I am done with all my questions. Do you have any other questions or
is only
anything you want to answer by
someone,
yourself?
Dr. Pallavi is asking, is only academic experience is enough or non-academic experience? So I
Huh.
would say, yeah. So I would say experience as in for a surgical specialty, experience as in they'll ask you for your surgical logbook. You need to have
Hmm.
your surgical logbook of 2 years, previous 2 years, right? You and suppose I being a plastic surgeon, I'm like, okay, I want to come as a cosmetic surgeon, so I need to show that okay, since past 2 years or even during my residency, I was doing cosmetic procedures. I've done hundreds
Right.
of this, 200s of this, all those things. So Definitely academic and non-academic, it depends. Like suppose you want to apply a job here as a teacher, a doctor, but as a teacher in a medical university, then definitely your experience change. I would love, and I would say that whichever specialty you are, whichever type of post you want to apply, depending upon that you should have the experience, and it should be more of clinical experience what they will be seeking for. But if you are
For
applying as a
surgeons, it is straightforward. We have our
yes,
logbook signed
exactly,
by the
head of the department or
head of the department.
yeah.
But what about the medical guys? How can they prove their experience?
So suppose a medical guy who has like suppose a cardiologist, he need to show his like cardiac procedures, angiography and
Right.
angioplasties and all those things.
Hmm.
Simple medicine guy, I think he need to show his tappings, he needs to show his all those things. So I think mostly what they will be asking for is a clinical experience. Non-academic or academic, then maybe I mean it adds to your CV. It adds to your CV. Okay, I was a teacher, I worked there, I was a guide or a
Hmm.
co-guide for the thesis or for the projects of students. I have this patent on my name, I have this thesis or publications on my name. That definitely helps. But as an experience for a surgeon or for sort of procedural branches, what they will be seeking for is your experience in that.
Perfect. Very well answered.
Yeah.
So we have answered all the comments, and my questions are also now over.
Yeah.
So anything you would
One
like
thing
to add?
I was saying, like to all the students who are preparing or getting their documents ready, is there any gap in education creating any issue? Someone just asked, is there any gap in education? So definitely, a, a gap in education, as in like you got graduated and then you didn't work, then you got your postgrad. So there are two types of gap. One is you were preparing for exams in between like 6 months or 1 year, or the second is you got MD medicine, you got MSLG, and then you didn't work for 6 years for personal reasons, for health reasons, for family reasons.
Hmm.
Then definitely there might be issues to that they will be asking you like what was the reason. Maybe you need to clarify why you weren't working. And before they take you in, they'll be asking you to have then that certain amount of experience at least before you come in.
Right.
Yeah, it's not like you have to fill those 6 years with a 6 years experience, but they'll be asking you for a fresh maybe 2 years,
Explanation.
3 years of experience and explanation. Yeah. One thing I was
Got
saying,
it.
like whenever you prepare your documents for either for any licensing here in DH or DUH, make sure all the documents are being forwarded from your
Hmm.
I think I'm at wrong place, as all people here are super senior, but as I'm here, so I just wanted to ask neat aspirant. The message went. Just see, someone has
I,
answered.
I I somehow can't read the comments. I don't know why.
Messages are popping up, but
Oh yes, yes. Now I am able to read them. Somehow I
so
clicked something wrong.
what I
Yes.
was saying is all your documents, they're like especially good standing certificate which you get from your medical council, from DMC, you get from whichever respective medical council you are registered in. They'll give you a good standing certificate, which is a must if you want to get your
Hmm.
data flow, if you want to get your registration done here. That has a certain time limit, like 3 months, 6 months. So after that, that expires, right? So
Right.
rest all documents, they should be getting forwarded through HR. Like suppose I was working with Naman in his clinic, he gave me a job and I want a work experience from him. So a single doctor or a single a recommendation letter or a work experience or your logbook sign is not going to help. Your HR, it should always be forwarded through HR. Because I got one of my experience letter from Medanta when I was working in. So I just got the experience letter and a work logbook signed by the head of the department. I submitted that. And then I got a reply from the data flow system that doctor, this document is not valid. It has to go through
Hmm.
HR.
Come from the
Because
HR. Right.
from the HR. So because they what they do is during data flow is they see, okay, this is the hospital, this is the clinical setup. They'll straight
Hmm.
away send an email to the HR of the hospital. And then the HR has to verify, okay, yeah, this document was issued by us. It's a valid thing. Doctor was here, he worked, whatever. So otherwise they'll say, no, no, we didn't give this document because they had no idea. You got it directly from the doctor. No. So you have to get all the
Right.
documents from HR. You have to have your good standing certificate. Make sure when you apply for it, rest everything is ready. Don't apply the good standing now and you have nothing ready as of now, because that has a validity of 3 or 6 months, whatever. So
Okay.
apply it when you
Mhm.
have rest of the things ready. So it will not be required.
Perfect.
For the
And somebody is asking when will the episode of Dr. Ravi will be out? It will be out soon.
good
Nice.
question.
And I think we are done here.
What
Private
else?
setup. Will work experience count if working in private setup? Yeah, as
Definitely,
you
yes,
already
yes.
said.
It helps.
Yes,
It
yes.
helps. It helps. It helps. Even if it's your own hospital or something, get your document verified from your hospital. Like the official email
Hmm.
ID or the official HR, not just your own letterhead or something. Yeah. What else I can say? There is a whole list of what all countries are tier one, tier two, tier three. Yeah, one really important thing now I would like to highlight. I made a note yesterday. I forgot now. Lots of students, they go out of India for their med school, right? They go to China,
Right.
they go to Kazakh, they go to
Russia.
Bangladesh, they go to Russia.
There is
So
somebody
make sure.
asking about Russia as well in the comments here.
Is it so? I would
Yes,
you
yes,
can,
yes.
yeah, you can go
Durgesh
through the
Shinde. Hmm.
uh, you can go through the whole list of countries. It's mentioned in the DHA, which are tier one, tier two, tier three. So mostly the Indian students, those who go for their med school, are tier three countries. I would like to remind: Armenia, Bangladesh, China, Kazakhstan, Nepal, Pakistan, Philippines, Russia, Sri Lanka, and Uzbekistan. They all are tier three countries.
Okay.
So when you get your med school done from there, you are right now a tier three graduate from there, right? Make
Hmm.
sure you get your things now either from tier one or tier two country to get
Hmm.
yourself validated here as a specialist or as a,
And India
because
itself, which tier is
tier two,
India?
tier two, tier
Tier
two. So
two. And
if you are MD or MS or DNB right now, only MD, MS or DNB from India, you will be considered as tier three. If you will come with just MD, MS or DNB degree from India, they will not be making you as a consultant, right?
hmm.
Yeah,
Now I
once
got it.
you
Yes.
yeah once you do your DM or MCA, then it becomes a tier two. Then your level changes, right? Then it
Right.
becomes tier two. Then you get some experience. Then you can appear for their consultancy exam. The third thing important is, if you are a tier three with all your degrees, with all your MD, MS, MCS, DM, whatever, everything from a tier three country, the list is there. You can never become a consultant in UAE. Never. Whatever experience you take, whatever your salary might be more
Hmm.
than a consultant. Suppose I am from like a tier three country and I have
Oh.
an amazing experience, like a really good name, tons of
Hmm.
patients are following me. So your post will not be a consultant in a good public semi government or a government setup. A private clinic will
Right.
hire you because you have tons of patients following, you have a good name, you have a good hand. They
Hmm.
might be giving you more than a consultant. I mean, you will be just like a
Hmm.
plastic surgeon or a diabetologist or an endocrinologist. They'll be giving you more than what a consultant is earning in a established bigger setups. But
Title.
the licensing
Hmm.
title, you will not be consultant ever if you are a tier three degree holder, for sure. Yeah.
Got it. Got it. Perfect. Perfect. I think
So yeah.
yes. Do you have any other thing to add? We are just about to
uh,
touch the 1 hour mark, which is the time I
mm,
decided actually.
I think a few things I have mentioned about for the nurses. Yeah, one more thing
Right.
for those who are now a special sort of audience, those who are BAMS and BHMS in India. Like those who are not MBBS or BDS. So they can, even for a dentist, I have kept a note here about exam, their experience. Then those who are of these fields, they can just DM us. We'll answer over there. But for the nurses, it's like BSc, MSc. For the technicians, by the way, there is a huge demand for those who are lab technicians, for those who are cath lab technicians, for those
Oh,
who are
okay.
radiology technicians, for those who are ECG technicians, echo technicians, sonographers, for all these
Hmm.
allied paramedic branches. It's a huge in demand. So, but they need good certifications like a graduate degree, 4 years, 5 years
Hmm.
apprenticeship, with some 2 or 3 years of majority like 2 or 3 years of experience after that. Then you can come and work here. I'm not
I
really
think we
sure
can.
of, yeah, I'm
Uh,
not really sure of the salary slab, how much they are getting in a big hospital or a small hospital. That I can just figure it out, and someone can DM us, and we can answer over there.
Yeah, I think that would be a good thing to talk about actually about
Yeah,
paramedical
paramedic.
field in as a
Yeah,
whole
yeah,
itself. And you were mentioning something about the dental stream, and I
yeah,
interrupted
yeah.
you. I think you can
Uh,
say if you have some points prepared.
for dentists, I kept a note here. For a dentist, if you are a tier one country in for a specialist post, you don't need any experience. But for a
Okay.
consultant, even from tier one, you need 2 years of experience. In tier two, again for specialists, you don't need an experience. But for a consultant, you need a 5 years of experience to become a consultant from a tier two.
Hmm.
India, even if you are MDS, it falls in tier three for dentists. So
Okay.
you need to have at least 3 years of experience to become a specialist. You will never become a consultant. Yeah, that
Right.
is
So it's pretty much similar to
yeah,
the
yeah,
MBBS stream.
yeah. So you will
Okay.
not become a consultant. So that's what again I'm saying. Don't look into these posts that doctor. Will I be a specialist? Will I be a consultant? What you should be
Hmm.
looking at it. What will be your working setups? Either it's a big or because I've seen people working in a smaller setup getting more paid than what I'm getting in my hospital. But my
Okay.
hospital is like more secure. You have a bigger team, bigger setup. Everything is being taken care of.
Hmm.
In a small setup, it's you only who will be doing all the like insurance thing, coding thing. There are tons of
Hmm. It's got it. It's like a
there will
one man army or a team.
yeah, exactly. So they will
Hmm.
be giving you more, but then you have other
Hmm.
extracurricular, like things to do. So don't look at into specialist or a consultant post. See what is the salary slab. If that fits you in, I think you should be getting clinical experience more, getting good certifications from either first world countries or even if you are in India, getting some
Hmm.
publications, getting some researches, getting some, like either a textbook, a book on your name or something that sometimes adds. And yeah, that helps you.
Perfect.
Yeah.
So I think I would like to uh, finish it now.
Yeah,
And
let's.
to answer our original question, is UAE for me or not? I think there is sufficient scope for a lot of branches.
Hmm.
And if you are able to find your place, and if you are really passionate about branches and also the country, I think you should
Okay.
try for
Yeah.
the
But,
country as well. And otherwise, do not compromise on your branch, as
yes,
Dr.
yes,
Ashish
yes.
advised.
First finish your all education from the best possible
Yes,
institute and degrees.
yes. And if
Then
exactly, if you think your branch has less scope, then maybe go to a tier two or a tier one country and try to get some experience from tier one countries, especially.
yes, yes.
And also regarding the mentorship, Dr. Zaki and Dr. Gaurav, please contact us again on email, and we'll be able to get you in touch with Dr. Ashish. And he has accepted it online, so I'm sure he'll be able to mentor you
I
guys.
saw two messages popping up just in one line. I will answer. You can answer. You can send us a private DM on my either YouTube on my Insta channel. You can follow us. Two answers is yes. You can have your own private setup. Being you are a doctor, you want to set up a cafe, you want to set up a restaurant, you want to set up a clinic. Whatever you can set up, you need a hefty amount of money for that. And definitely you need to register everything under the law proper in a proper way.
Right.
Second thing is someone asked about is there any place left for people after MBBS. We already spoke. So if we will record this and we will put it on our channel, definitely you can see, you will
Hmm.
be getting answer for sure. Yeah.
Perfect. And yep, I think we are done. And
Yes.
thank you so much. Thank you so much, Dr. Ashish, for taking out time on a Sunday morning.
It's gym time now.
Yeah, exactly. It's also afternoon here almost.
Yeah, yeah. Okay.
Uh,
And we'll
Nice
come
to,
up
and
with
we can actually connect again for the paramedical topic and any other
exactly,
questions. And
exactly.
given your enthusiasm, I think we can actually make it like a series. and publish a few more
three
videos.
three areas still we need to make is one is paramedics, you said, one is a new
Right,
licensing system what they come up with,
right.
and the third is for uh, regarding studies, books, and getting data flow and all.
Mm,
If we have some definitive plan with us,
perfect.
yeah. Okay,
Okay, then.
thank you.
Okay,
Great,
bye. Have a nice
great end
day.
of
Have a nice
weekend.
day.
Bye.
Bye, bye.